ABC 10's Becca Habegger was there today for the governor's presentation. And Becca, the budget nearly 300 pages long, I understand.
Yeah, Chris, what the New York Times might call the Sunday read. You know, when you have a little extra time on your hands, it can be so easy to get into the weeds with this. But here at ABC 10, we stand for you. I went into that budget presentation listening for the practical takeaways that could impact our wallets, our quality of life. So here are some of those big proposals.
I'm confident in this blueprint. I think we're being thoughtful.
Let's start with the high cost of living here in California. Newsom wants to spend $2 billion on affordable housing, including grants and tax credits. He also plans on stopping a gas tax inflation increase that was set to kick in July 1st.
It's a challenging time for all of us.
Turning to COVID, Newsom wants to spend $2.7 billion on things like more testing, vaccines and boosters, support for hospitals and frontline workers. And one measure that would affect a lot of people is bringing back paid sick leave for COVID-19. After a law offering that protection for full-time workers in California expired back in September.
This is a top priority for me. Sick leave.
Public safety was another major point for Newsom, especially after last month's string of smash-and-grab robberies. Newsom wants to spend $356 million over the next 3 years on bolstering law enforcement.
We have to hold people accountable for breaking the law in these organized ways.
In terms of health care, Governor Newsom wants to put more money toward reducing the cost of insurance premiums, expanding reproductive services, fighting the opioid crisis, making mental health care more accessible, and more.
California is poised to be, if this proposal is supported, the first state in the country to achieve universal access to health coverage. So what does that mean? It means full scope Medi-Cal, including long-term care, IHSS, behavioral health to all low-income Californians, regardless of immigration status.
For that, he set a goal of January 2024.
Universal health care means blank check health care for anybody. And I just don't think that we can afford that.
State Senator Jim Newsom gave the response for the California Senate Republicans. While critical of some of the proposals, he says he's also pleased to see the governor including some Republican priorities.
The governor seems to finally get that there's a public safety problem in California.
So if you liked what you heard from the governor today, if you didn't like what you heard, keep in mind, nothing is set in stone. This kicks off a months-long process of negotiations and changes. The governor will present a revised budget in May, and ultimately lawmakers will have to approve a final version before it goes into effect starting July 1st. So, Chris, of course, a lot of steps between then and between now and then, of course.
Something to keep in mind. We have more information on our website. Becca, thank you. The governor also wants to spend $2 billion for mental health services, housing, and clearing homeless encampments. That is on top of last year's $12 billion package.
This year's budget, if there's any message I want to drive, it's this next slide message. We want to cut red tape this year, focus on behavioral health, and we are investing $55,000 and investing in 55,000 new homes and treatment beds with this 2-year commitment.
So here's a breakdown of how that $2 billion would be spent. $1.5 billion would be used to provide fast solutions to get people off the streets and into behavioral health treatment. $500 million would go to tackle encampments, $10 million for people to return home and fund mobile medical teams.